Welcome back to the Lynne Hayes Freeland Show. My guest today is Dr. Rhonda Moore Johnson. We've been talking about, it's kind of like a COVID-19 / vaccine update. There's so much to talk about in this area. We could probably do 2 whole hours here, but we only have half an hour. So I want to circle back because when this whole pandemic started and then the vaccine was rolled out, there was a lot of very open resistance within the Black community. Then we saw a concentrated effort to educate our community about the vaccine. Where do we stand now? Is that hesitance still there?
I think you have to define it by age groups. Certainly, we know that African American seniors have been very willing to get vaccinated. The African American community has suffered a horrible loss from COVID. We have had deaths from COVID-19 nationally that were 2 to 3 times the rate of white Americans. The only other group, brown groups such as Hispanic, Latino, and Native Americans have suffered similar losses. But when you look at our population size in relation to the number of people who got infected and the number of people who died, we've had disproportionate mortality from COVID. Now, there are reasons why many African Americans, despite this loss, and most African Americans know people who have died from COVID. But despite this loss, there was resistance initially to the vaccine. Some of it has to do with historical features, such as, the Tuskegee syphilis experiment. That has generated a lot of distrust in the government, a lot of distrust in the healthcare system. Then you add on things like Henrietta Lacks and the history of medical experimentation. So for many African Americans, they said, we don't want to be first. We'll look at and see what happens, but we're not going to be the first to take it. Mm-hmm. Now, as time has gone on, there has been a concerted effort from many in the African American community, physicians, nurses, clergy, people who have had COVID-19, to try to get the correct information out. And I think that has been working. We're seeing more and more African Americans be vaccinated, but the key is, and there was confusion on how to get a vaccine. In the early rollout, you had to, go online, or you had to call 211 in this area, and many people could not access the online system.
You can say it. It was a mess.
It really was.
It was a mess.
Yes.
Yeah.
But now the vaccine is accessible, and there are so many community sites. So, for example, you can get a vaccine at some of our churches. This upcoming weekend, there will be vaccination sites in churches. There have been vaccination sites, clinics in the senior high-rise buildings. So there are many opportunities to get a vaccine. And I suggest that people, even the news stations, the local news stations routinely have updates on where you can get a COVID vaccine every single day. So my encouragement for people is to know these 3 things. The vaccine is safe. The safety has been established. Out of 248 million people who have gotten these doses here in the United States, there's been some problems. Mm-hmm. We all know that the Johnson & Johnson vaccine was paused because of the blood clot issue. But now that has been unpaused and people are getting that vaccine. So, but I'm hoping that people will believe that these vaccines are safe. They were not rushed in their development. I'm telling you some of the reasons that I've heard as to why people are reluctant to get the vaccine. They don't believe that there's long-term safety. They believe that the vaccines were rushed in their development. And the truth is they weren't rushed. This technology has been around for a number of years, at least 5 years. The messenger RNA vaccines were developed for Zika and Ebola. It's just that Zika and Ebola did not touch American shores, so a lot of Americans didn't know about these messenger RNA vaccines.
Let me stop you for just a second. Go back to that point. the basic concept of these vaccines were already developed for Zika
Yes.
and Ebola.
The messenger RNA vaccines, yes.
Right.
Yes.
So that really does shoot down all of these concerns about it was too rushed, it happened too
Right.
fast.
Absolutely. We had the technology, we just applied it to this pandemic. The other concern is that the vaccines, particularly messenger RNA vaccines, will alter someone's DNA and genetic material. That is absolutely false. From a biochemical standpoint, cellular biology, it cannot happen, Lynn. The sequence.
I'm sorry, I'm laughing, but I shouldn't be. But those are the kinds of things that you hear.
Yes, yes. And there's another rumor around infertility, that the vaccines cause infertility. So that is certainly not true. There have been thousands of women who have had pregnancies post-vaccination. So the vaccines do not alter your fertility. I do want to say that COVID itself, getting COVID, if you're a young man, COVID can infect your testicles. It's known to decrease sperm production. So if there's anything that will potentially cause a decrease in fertility, it's COVID infection itself. So there are many reasons. There's a lot of misinformation out there around these vaccines. We just have to keep addressing it. And I don't believe in shaming and blaming. I try to meet people where they are. Many people are hesitant. Many people to this day are afraid of these vaccines. You know, they do cause some side effects, particularly the second shot.
Hold that thought. We'll pick that up. We got to take another commercial break. We'll pick it right up at the second shot. See, aren't you glad you tuned in today? I've learned a lot, and I know a lot about this stuff. We'll be back in a minute. Don't go away.